hello, health heads. Welcome and thank you for checking into this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So let's tell them what's on the agenda for today, Heather.
I'm excited because today we're actually meeting with somebody who I've worked with or used to work with for a really long time. So a former colleague, Seth Merritt, the CEO and founder of Welby Health. Seth has spent the last 15 years working on innovative care delivery models for leading healthcare systems. That's where we met, and is very passionate about lowering the cost of quality care and improving accessibility for patients. Definitely ties into our, innovation and uprising themes here on the show. Seth has helped some of the most prominent American healthcare companies plan and deploy enterprise-wide programs that disrupt the status quo, including Anthem Blue Cross and Aetna CVS. That's where we met, was at Aetna. And his value-based healthcare initiatives and negotiating skills have helped bridge the gap between C-suite leaders, corporate partners, and technology providers. Anyhow, he's got all sorts of information in value-based care. And he's here to tell us all about what he's doing with Welby Health, where he's plugging into that universe.
So I heard lower cost, higher access, and disruptor. So
Yes.
That sounds like it's going to be a good conversation. So without further ado, let's jump into our conversation with Seth from Welby.
Hi, and welcome to the Healthcare Uprising podcast. Today we have Seth Merritt, CEO and founder of Welby Health. Welcome to the show, Seth.
Thank you for having me. Good to be here. I'm excited to chat with you today.
Yeah. So Seth and I go way back. We worked together at Aetna, and Seth, you're going to tell us a little bit about why Welby Health came to be, because I think of our experience there and what we learned and what you learned specifically. But tell us a little bit about your background and just kind of generally the kind of work you've done in the healthcare space, and ultimately really kind of what led you here to this point to found and bring Welby Health to the universe.
Yeah. So I never expected I was going to get into healthcare. When I went to school, I studied communications. I had no idea what healthcare business actually was. I came out of school, I went to go work for a IPA, which is basically like a physician association. And they taught me everything I knew about just like managed care and how everything works. And for some reason I was good at it. So I've just stayed in healthcare. I spent probably 20 years working for either providers or health plans. So like you said, we worked at Aetna. I've worked at Blue Cross. I worked at when it was CVS. I worked for like regional health plans. Most of my time was either doing provider network contracting, so like dealing with the doctors and the hospitals and like negotiating rates and making sure everyone stayed in network and people were funded and everything, or business development things where we were doing new products or like risk sharing arrangements and things like that with health systems. So always been on sort of the, I guess you would call it, cutting edge of like payment methodology and things that we were trying to do in terms of trying to move providers and systems into more fee for value versus fee for service payments in the industry. So did a lot of that. In terms of like Welby and how that ended up starting is I realized two things when we were like, so Heather and I worked together, we were building ACO products. So these are where we would go to like health systems, essentially get them to take a huge rate cut to participate in this like custom network product that we would build around them with the goal that, hey, these populations are going to end up being healthier. It's going to be a more coordinated experience for patients. And, that's what we were building. And two things struck out to me in like dealing with that is, one is it was fundamentally a financial transaction. Like we were shifting risk over to the health systems, but nobody was fundamentally investing in any behavioral change for patients. And I think at the end of the day, it was kind of like, hey, we're going to cut you in on some of our finances here, but we expect you to go do all this extra work of like engaging patients, making them healthier, identifying who's at risk, like managing them. But the primary care doctors are already working 12 hours a day anyway. To put more work on them was kind of ridiculous. And that wasn't the solution. And then at the same time, it was happening and we were going and selling it to these like big plan sponsors, and really like nobody wanted it. We were like pushing it out there like, hey, these are like big cost savings. You can get better outcomes. And it was like a slog to go sell it. So like even employers, when we're like, hey, we're going to save you 20% on your healthcare, but you got to go deploy this like new product to your employees, they weren't chomping at the bit to go do this anyway either. So
I
like
remember
how,
that.
what's that?
I remember that part.
Yes, like what is going on? Like we're trying to
Yeah,
make patients healthier here. The employers don't want it. The doctors don't have time to go do
right.
anything with it. Like we're just kind of like lining pockets of big health systems. How are we actually like getting behavioral change to patients, which is what you need if you're going to lower total cost of
Mhm.
care. So that's what prompted me to do what I'm doing, where I was just thinking originally it was just if we could get in front of patients and explain what their conditions are, like everything is really driven by a lot of complex, chronic disease, like diabetes, hypertension, heart disease, things like that are really like lifestyle focused. And if we could actually just get in front of them, get them to understand what their conditions are, push them in the right directions, we would end up saving a lot of money. And it wouldn't be so much about, lowering the costs of tests or dealing with like these high risk patients and getting them to avoid the emergency room or hospitalizations or things. You can actually get preventative with them. And that's what led me to start what is now Welby. Originally, it was like a patient facing pre-diabetes app where I was like, hey, we could push nudge reminders and things to patients about like, hey, this is why it's important to watch what you eat, manage stress. Like this is what's going to happen to you in 5 years if this doesn't get under control, that type of thing. And get patients to engage and come at it like differently. If you think about the health system, there's really kind of like three constituents. There's health plans, there's health systems, and there's pharmaceutical companies. And all three of them like do not want you healthy. Like fundamentally, it's not in their business interest to do so. I mean,
It
sure,
comes up
there's
a
like
lot.
Yeah.
there's
Yep.
amazing people in there that want that, but like at the end of the day, like the business dynamics of those things aren't
Mhm.
designed to get people healthy. No one gets paid when everybody's healthy. So I was just thinking maybe just coming at it from a different perspective, take what I've learned in the healthcare field and then go use more technology and like have some direct mechanism into patients was how I ended up starting what is now, Welby. Obviously, like we've evolved and there's different things we do beyond that, but that was my initial concept of like how we could like tackle the problem of healthcare and getting people to like manage their own care a little bit better.
Since you started with the app and it was more like patient focused, so that's more of like consumer, right? Focus, not going through a provider, which is what Wellbe Health is doing now, right? That's where kind of the
Mhm.
biggest shift is. Why did you move away from going direct to kind of the patient or direct to consumer, as we say in the marketing world, versus like direct to the business provider group and then come in through that doorway?
Yeah, I think a bunch of things. One, it's super expensive to go direct to consumers, so getting a brand presence out there to consumers
Mhm.
is really difficult. I think we needed some clinical validation, and at the end of the day, like my two constituents are both patients and doctors. Like we're trying to make the job easier for doctors ultimately to like manage these patients. So I thought it was a better avenue to go work with the physician practices because then we can have an integrated solution, like we're working on behalf of the doctor and the patient
Mhm.
together. We're kind of sitting in the background. And also just same thing I was just talking about, like there has to be some financial construct for us to make money and be in existence and grow. And like part of that is like partnering with the physicians where the services that we can provide will get paid for under different reimbursement methodologies. But so like we can actually get paid for doing that care. Whereas if we were just working directly in with patients, we may not be able to do that.
Mhm.
And it's also just a much harder mechanism to get into consumers. We've always had it in the back of our mind, like the product could be sold into consumers, but our focus has really just been mainly like channeling through the physician practices.
Okay. Yeah. So you're now provider, say provider first, but with the ultimate goal of benefiting the patient in addition to the provider, right?
Yeah,
So
100%.
so what do you think are the biggest challenges, right? That doctors and are these mostly primary care doctors that you're like independent primary care practices, but I know you deal with health systems and like larger provider groups as well. Maybe it's a big mix, but like what are the challenges that they're facing? Like why Wellbe? Like what are you solving for on their behalf, I guess?
Yeah, I mean, I think it varies by the individual physician offices versus like health systems and things like that.
Mhm.
I think the three things we say that we solve, for with the provider groups is one, you're getting better access to patient care. Like everybody is super stretched in terms of resources. They don't have enough people and bodies and tools to touch all their patients as much as they would want to. So by adding some of our resources through either the technology or our people, we get more touch points for their patients. So the patients get better access. we reduce a lot of admin burden for the physician practices. So there's a lot of manual work dealing with complex disease patients. So whether that's getting prior authorizations, making sure they're taking their medications, getting them in with a specialist, like getting them back into like their primary care visit, dealing with like a post-hospitalization discharge, all that stuff takes resources from a physician office that's already pretty strapped and doesn't really have any free dollars to go do that. By enrolling patients in our program, like we take the risk to go do all that work for those providers. So we get them into our, care management programs from Welby, and then we handle all that like operational, burden for them. And then financially, since this does get reimbursed through, like Medicare, Medicaid, health plans, they pay for the services that we do. The practices actually can generate some revenue off of the services that we provide. So a lot of the things we do are really difficult to stand up. And if you don't have a technology infrastructure to kind of like manage this patient population, it's easy to like lose money doing what we're doing. But giving them that is sort of like a turnkey solution, because the other problem I think for just the healthcare industry in general is everybody is sort of tapped. There's like no more resources free. There's no more people free. There's no more time free. So just even if you wanted to go do something now, it's really hard to just like find the people to go do it, or like the brain space to go think about how we're going to go do this. Everyone's sort of like reacting to all the issues going on. And I think specifically with technology, there's so much new stuff out there. I think that people in the healthcare world are probably like ill-equipped to really evaluate it, just because it's so new and so powerful. I think some of the stuff that's out there, and like unless you're really like super cutting edge technology, which healthcare has never ever been, it's kind of hard to even just evaluate what is there and how to use it.
Yeah.
So that's why we come at it like a little bit outside the like traditional lens.
Yeah. So you can kind of like plug in, right, to kind of the operating model of a provider group to provide that technology and kind of fill that gap, right? That need that
Yeah,
they may
basically
have.
like what we built our system to kind of sit on top of the provider's medical records. So they're still doing
Okay.
all the stuff that they're doing, like charting and documenting notes and things like that in their system. And then we just plug into it so we can work outside of their system, but then everything else that they need goes, back into their system. So it's, again, like there's no brain power for physician practices to like learn new software or log into another tool or do something like that. Like they just want to keep doing what they're doing. That's where we can like augment their needs for those patients that they want to get better access for, but just haven't have the resources to be able to do it.
Yeah, just take off the administrative burden in a lot of ways.
Yeah, there's a lot of administrative burden just sitting out there
Yeah.
for no reason.
They're really well, and I think you and I've talked about it, but it's like each health plan has its own portal, their own requirements, their own this, their own that. So it's like, you've got Blue Cross, you've got Aetna, you've got, Cigna, United. Like that's a big part for anyone who's not really familiar with what administrative burden means. That's a huge part of it. So
Yeah. And like the whole
built that.
stuff with like the value-based care things for providers trying to figure out like, how do I move into this new world? And like all those people have their own ideas of quality. So like, hey, for Cigna, I've got to like hit these 4 metrics. For Elements, I got to hit these 6 metrics. For Medicare shared savings, I have this different program. So like a typical physician who's seeing 20 patients a day for like 12 minutes at a time, how are they going to evaluate what the patient actually needs, like before the 12 minutes, treat them and figure out like, okay, am I maximizing my like reimbursement model for Cigna for this patient? Am I doing what Aetna wants me to do for like this other patient? It's kind of crazy that we ask those providers to do that much work. And honestly, before I did this, I had no idea how crazy like life for a primary care physician actually was until I started just like seeing it with like our clients, but then also just researching, for kind of like market analysis, what is an actual like primary care office doing? And to think that there's a concept of, hey, the primary care is going to be the quarterback for like all this stuff going on with like this patient and managing them is not fair to like primary care doctors. They are the like most overworked, they are the least paid, and they have the like biggest patient panel, and they're also probably like the most likely to just still trying to be an independent practice, which is getting like increasingly difficult and I would say almost impossible to like really manage an independent practice today and have it like make any sense financially.
So, so you said the administrative process is different depending on who is covering the process. That's
Yeah, I mean, like,
how do they not standardize that? That's crazy. So you have to do a different set of paperwork depending on the
Which health
company,
plan?
which health plan you're dealing with.
Hmm.
Even
yeah,
for the same problem,
And then
you
add
have to do
Medicaid.
different paperwork.
Yeah, Medicaid and Medicare then is outside of commercial plans, right? You've got that whole animal as well.
yeah, and
I
even like
wow.
drugs, like if you're prescribing medication to patients, like some plans cover ABC, some plans cover XYZ. They want prior authorization for this one, and then you know, if you, heaven forbid, you prescribe something to a patient, it's not covered. The patient then gets like really upset that they have this coverage. They're going to come back to you as the provider. And you're like, hey, I'm just like working here. It's not my fault. Like, go deal with your health plan. And then patients are, I mean, I've even been in this situation where it's like, call the health plan. They're like, no, you got to call your provider. And then you call your provider. And they're like, no, the health plan did this. You got to call the health plan. And then like nobody really cares. And it's just until you get so irritated that you give up. Um, Really like the last person involved in healthcare decisions is like the patient for the most part, which is really just odd. But it is true. It's like it's the health plans, the providers, and then the patients.
I can see why these doctors' offices could use this kind of help when it's that kind of a maze you got to run through for every patient just to make sure, stuff's getting paid for.
Yeah, I mean, I think of it as if you're a physician, you're seeing 20 patients in a 10-hour day and then doing like your charting at 9 o'clock at night and putting your notes in the EMR. When are you ever supposed to figure out, well, this is why Mrs. Smith's diabetes is not getting under control. And like, this is what's happened to her A1C over the last like 6 months and what's happening. Like, let's tweak her medication like slightly. That is how you get healthier patients. But asking a person to go do that who's working in the current healthcare system is not realistic. And it never will change unless we are doing something different. I don't know if I've stolen this or absorbed it, but I always say there is no like healthcare system in America. It's a sick care system. It's like we
Hmm.
respond when people are ill and give them something to treat it. There is nothing on the front end that promotes just general like health and wellness other than stuff outside the healthcare system that's not like paid for. Everything is just reactive to when people present something that they need. Um, and that's why, like, if you look at any of the data, like our costs around these like chronic diseases are just continue to go up. The prevalence continues to go up, no matter how much money we like throw at things. It's not changing because at the end of the day, it's whether Seth is going to, go to the gym or like stop smoking or stop drinking or deal with my stress in a different way. Until I deal with that, I'm still going to end up with the same chronic diseases, or if I already have them, they're just going to get worse. And that's not like a physician's job to go tell me to like go to the gym.
Yeah.
There's a lot of and Seth, I think you and I, based on our experience, at Aetna when the Accountable Care Solutions division was being built, which is where you and I met, I was really excited about it. It was kind of like early stages of this kind of concept of value-based care. And it was like all good intentions, right? But like to your point earlier, we ultimately couldn't really do that, right? Like it wasn't it just wasn't playing out, I think, the way that anyone had hoped for. And I feel like though there was so many really smart people like you and who have now kind of gone on and left these big health plans are creating these startups that are actually doing the things that they wanted to do. And so like Welby Health, I worked for Equality Health. It was kind of same situation. I see a lot of these companies that are trying to solve for this issue because the health plans have ultimately kind of created this complexity, right? Like through their processes and being so different. But meanwhile, we're not really getting anybody better. And so I feel like Welby, amongst others, are kind of now here to solve that problem in their own little universe, right? Like that's kind of where the change happens, I think. So I hope.
Yeah. And that's what I was saying. I mean, like, there's definitely like good people in the health plans and the
Yeah,
provider groups and everything that like want to like move the needle and like make change, and they're
exactly.
working at it. Um, it's just very difficult, and you're
Hmm.
always like coming across like competing priorities or just getting access to things. I mean, one of the things that was really cool about the accountable care solutions team when I went in there is it was sort of like a startup incubator, like within
Hmm.
a broad company. So it was like we worked for Aetna, but ACS was like its own team. I forget the exact structure, but it had like a CEO and like
Yeah.
our own leadership org. So we could like move things like more quickly. And then
Yeah, we
like
felt we're nimble. Yeah. And a little bit,
by
have a
the
little bit
time
more
I got there, that
autonomy.
was like devolving, and it was like we were rolling like back into Aetna, and it was still sort of like all the corporate approvals like went back into Aetna, so
Right.
slow. But like there they had like a kind of software team that was building like software tools that they were trying to get to providers. They had like some consulting arm that they were trying to get into providers to explain some of these things. Like we were doing the contracting work and all of that. And then it just felt like the software stuff sort of went away, the consulting stuff sort of went away, and then we were just coming in and being like, hey, you got to cut your rates to X and we'll go do this. But then without the software and without the tools for the providers to go move the needle, that's where it just seemed like it didn't work. And maybe like the software stuff had no ROI, like maybe it just wasn't working and that's why it like went away. But to me, that's where I think some of the cool things in the startup world are moving the needle. It's like we have the
Hmm.
experience doing these things, but how do we build, software or like tools to, ultimately like help people manage this? I purposely like adamantly stayed away from like selling our services into health plans because it's like so slow and
Hmm.
like not innovative really. I mean, like they try to be, but it's just like that's not what they do. I
They're
think
not
like
built that way. Yeah.
I've come to realize that like big companies like that aren't designed to innovate. They buy companies that are innovative and roll them into a bigger org, and then they figure out how to like really systematize the process and do things more efficiently, build on their scale with sales and marketing and get more people involved. But like coming up with like a new product or a service or something at a company of that scale is not really even feasible that I can think of. I mean, we did a couple things, but not anything crazy. Whereas like in our world, it's like, hey, we want to do something, like we release
You
it
do it.
tomorrow if we want to. We don't really have any constraints over what we can or can't do.
Yeah. That's where I think, to me anyway, and especially like since launching this podcast too, and we talked to so many different folks that are doing things just like this. Um, like I feel like that this is where the change happens, and there's just so much cool stuff out there, and technology and AI, and like leveraging all of that is huge for the healthcare industry. I think this is like where we are really starting to see a big shift, where I feel like in the, for years and years, the health plans really kind of dictated how we received access experienced healthcare. And now with like the onset of like technology and AI and like healthcare in your hand, we've got an app for everything. Like we are empowered as patients, as plan members, as consumers to start to kind of better direct our healthcare, like based on like what season of life we might be in, or maybe a condition that we have. Um,
Yeah.
so, so that's exciting. And actually, question for you, and I want to understand too, like, what does the experience feel like when Welby shows up in a provider's office, right? Like you're contracted with them. What does it feel like for the provider, the staff, and the patient? Like, how do they interact with Welby, and who do you? I know you have like care management teams, things of that nature. So maybe you can kind of dive into that a little bit.
Yeah, so basically how we work is we go to a provider practice. So we usually target, maybe like a 10 to 30 doctor practice of something that's like big, not huge, but something that can like have a decent like patient panel size that's worth, partnering with for us. We come in and say, we'll basically handle all your patient care in between office visits. You guys focus on patients when they come in the office or any like acute telemedicine visits. Everything else with your chronic disease patients, you're just going to outsource over to Welby. We'll go into the provider's EMR. We'll get a list of patients who are eligible. We'll contact those patients, explain what the program is, and try to get them to participate in the services that we provide. And then we just basically like pick up that work for those patients. So then instead of the doctor being the primary point of contact for that patient anymore. It's Welby. They have like a dedicated RN care manager who's responsible for them. They're dealing with like the day-to-day stuff. And if the provider, the physician needs to be involved with something, it's usually going to come from the nurse. So instead of taking a bunch of questions and things from like all their individual patients, they're just going to get like messages straight into their EMR from like their Welby nurse to say like, hey, I was talking to Heather today. Her blood pressure is under, out of control. We can't get under control. We tried adjusting the meds. This is what's happening. Like, what do you want to do? So they're just getting a curated set of information about a patient that really like is only going to be answerable by a physician, so all the like triage stuff comes away and they don't have to deal with it. And then from the patient's view, when they come on, they have a team from Welby that is doing everything from like monitoring their vitals. So whether that's like their blood pressure or their weight or their glucose or their, pulse oximetry, if they have like COPD or pneumonia or something like that, like we're actually monitoring all that stuff for them in real time. And then they have a dedicated care manager and like a whole care team from Welby where they have their direct contact information. So I'm sure you've experienced this, like if you want to talk to your doctor, you're probably going through like 4 sets of messages and just being triaged before you can even talk to them. Like the patients here like have the cell phone number essentially of their nurse and they can just contact them directly if they ever need anything, because we want to be like as proactive as possible for them. And then essentially for the patients, like we're giving them a comprehensive care plan about how to deal with their health conditions. So a lot of what we deal with is like high blood pressure, diabetes, congestive heart failure, COPD, chronic kidney disease, things where like what you eat, what you drink, how you're managing your stress are all important, how you're managing your medications. So we will actually build a care plan for that patient based on what they can realistically do, whether that's like just getting out more, getting them access to social services if they need those kinds of things, making sure they understand their medications, all of that. So we're doing like a comprehensive care plan for all of their health conditions. And then we're working with them over like a 6, 12, 24-month period over like, how do we get all this stuff under control?
Oh, wow.
So you come off of your medication or reduce your medication or like lose some weight so you're not having as much like stress on your heart, all that type of stuff. So we're kind of like a combination between a therapist, a personal trainer, and a health coach that's just like assigned into the patient. So that's why they really do a lot of engagement with our team and then take that off of the burden of the physician practice. And we essentially become like an extension of their office. So we work like in collaboration with their medical team, with their like operational team, with their billing team and everything. And we're just like an extra set of eyes and ears and hands and things for their patients who need the most help.
And it's not, oh, sorry, Jeremy, you wanted to ask a question, but real quick, it's not specific since you're like provider groups, you could get a mix of people that are like commercial insurance, like, me through my employer, could be Medicaid, could be Medicare. Is that pretty much kind of across the board? It's really just solely dependent on they've been identified for having these chronic conditions and then are kind of basically
So we
connected with
usually
you.
start with like traditional Medicare just because like they're the most prevalent in the office. We know exactly like how the reimbursements work. So it's not dependent on like their underlying contracts or benefits. Like we just talked about, every single commercial plan has 50 different rules, like whether they cover all of these services or not varies. Medicare, we know exactly what happens. Then we do Medicaid. So Medicaid is pretty clear, like by state, who covers what, does it make sense financially to go do it? And then we can also do commercial coverage. The thing about the commercial coverage, though, is a lot of the patients will have high deductible plans and they're not going to want to spend out of pocket like all of these services on the front end. So it's harder for us to engage with patients who have commercial. But yeah, it's just basically like condition focused and who's eligible for these programs based on like what disease states they have.
So that kind of brought it all together for me there. So you go through the doctor as the portal, but you work very hands-on with the patients too. So do you have like your own wearables and stuff that track all those the bio data and whatnot that you were talking about for the patients?
Yeah, we don't manufacture any hardware. We have vendors that we use for some of the stuff. So we'll like drop ship equipment into the patient. So whether that's like a blood pressure monitor or a scale or a glucometer or something, we'll send that to the patient and then that's already like configured into our system. We also just sync up with any of the stuff they have. So if they have like a Fitbit or an Apple Watch, like our app can plug into like HealthKit
Okay.
and stuff to grab that data and then push it into our system. And really like what our system is doing is we see that data, it's analyzing based on the patient's history. Is this like an outlier? Is this a weird thing we need to go engage with this patient on? So if they have like spikes of blood pressure or dramatic weight loss or things like that, it's immediately going to push a message back to the patient telling them things they should be doing or this is concerning, just so they know something is wrong. It's also going to like message into our nurse to say, hey, Heather just took uh, a blood pressure reading and it's 220 over 140, like very concerning, like you need to outreach to that patient immediately. So then it lets us get in
Mm.
front of potential exacerbations that are life threatening, but then also lets us track like over time, are we moving the needle in terms of getting these vitals under control so they're better managed?
That just keeps the doctor so much more connected with the patient too, in ways they wouldn't be otherwise. So that's always good as well.
Yeah, I mean, I think of it like my dad has diabetes and high blood pressure, and I imagine his like experience with his doctor. He has no idea what his blood pressure is like on a daily basis. Like he'll tell like, oh, I'm losing my vision, or like I get headaches and I feel faint. Like I have no data around that, like what that means. Maybe best case scenario, he wrote down a couple like blood pressure readings that he took over the 3 months since he last saw him, and a doctor is supposed to be like making a decision about that. If my dad was in our program, like we'd be monitoring his blood pressure in real time for the last 3 months. And I can tell you, oh, it's spiking in the evening because he doesn't take his meds, or it's, started at an average of 180 systolic, it's down to like 150. We're trending to 120. This is like our goal. And like as that's happened, his A1C has gone up because he's eating something inappropriate or whatever. And like we're going to find out how that's all working and then feeding that into the doctor. So instead of kind of flying blind of how to deal with this patient, it's like you have all this data, a nurse that's been watching him for the last 3 months and made her own assessments of like what's going on, can push that to the doctor before a visit, and then he can actually spend 2 minutes and be like, yep, I know what's going on. Like, this is what I'm going to do. And it's way easier for that doctor, but then it's also going to drive like much better outcome than randomly showing up and like looking at the chart 2 minutes before of what's in there and trying to figure out what's going on with someone who's managing, comorbid diseases.
Yeah, exactly. Exactly.
So, d- okay. So, like, you're capturing all this data, you're supporting the patient in between those visits to the provider, right? To their primary or special, I guess it could be specialist too, right?
Mhm.
Um, so like does the app kind of, I don't know, like deliver all of this information in some sort of way to the doctor so like they know, okay, so and so's on, working with Welby. I can like go in here and it's like a report or a summary or something.
Yes. So like the main thing that like our app is doing is one is it's digesting all the information, automating anything back to the patients. So sending them like reminders of things that they should be doing, pushing messages about their care plan that they need to be working on, all that type of stuff.
Hmm.
Um, it's also triaging all this stuff for our team. So like when a nurse comes in to work at Welby, it's like, here's my panel of 150 patients. It's automating who they need to talk to based on, what their prior vital readings were or like follow-up things for the patients. So like I said, if you don't have underlying technology, it's hard to just like do this kind of program. We're
Hmm.
just pushing everything to the nurses like, hey, call Heather, call Jeremy, call Seth. Like, this is what happened last week. This is what you need to do. It like automates all the soap notes for them and like records the call that they're on, generates it
Oh, wow.
so the nurse doesn't have to do anything. It can push it back into the EMR. If there's like elevated readings or things, it'll just like push that data back into the EMR and like push a message to the provider. So a lot of it is telling our team what to do because we're not at the point where it can just fully automatically like go make a clinical decision to somebody and tell somebody what to do. So it's pushing it to the nurse. You guys make the final clinical decision and then you can push it into the physician. Um, we do have some of our own like clinical assistant AI stuff that we've built for the nurse that can parse through all that stuff. So it's reading all the phone calls from the patients, all of the prior notes on the patient's account, the demographics of the patient, plus all these vitals that it's capturing to proactively tell both the patient and the nurse, like what are things that should be focused on next time they're trying to do like any sort of care management engagement.
So you've been doing this for a few years, and you've had some patients in the program for long enough that obviously the goal being improving health outcomes, right? Like stopping people from going to the ER, unnecessarily, not letting issues get worse. And how, like, what are you seeing? Like, are they, what is kind of what's the feedback? What are you starting to see from an experience perspective and outcomes?
Yeah, I mean, we only have limited access to data. The one thing I
Hmm.
don't have, since we don't partner with the health plans, is seeing claims data afterwards. So I
Oh,
don't
yeah.
know if we're ultimately like saving money at the end of the day,
Hmm.
just because I can't see it. I do know we have all the biometric data on patients, so we can
Hmm.
see we're seeing like a 20 to 30% reduction in systolic blood pressure within the first like 3 to 6 months of engaging. So we are getting there blood pressure under control. We're seeing a 20% plus reduction in A1C for like diabetic patients. So getting them down under control is something that we're seeing. We're also getting really great feedback from patients in terms of their patient experience as part of this. So we send out like a net promoter score to all the patients, and we have like a 97 net promoter score, which is crazy in healthcare. Everybody hates healthcare.
That's really
Um,
good. I saw that on your website, by the way.
yeah, they're the patients just like love it, and like getting all that access is things they never really knew they had before.
Yeah.
So I think that's a metric for us. And then just anecdotally, like we've seen things where we've definitely like avoided hospitalizations and ER visits from catching things like these like blood pressure readings, or on the other hand, like we've probably forced some ER visits from some of these because they needed to be there, but instead of like
Mm.
getting an ambulance and like getting them into an ER when it's like even worse, like getting them preventatively and then getting admitted into the hospital because we're seeing, elevated blood pressures, getting symptoms from the patients and like really pushing them. You actually need to go into the emergency room based on what's happening, but rather than have the patient have a stroke and come in like 5 hours later
Yeah.
in a much worse condition.
Yeah. And I imagine the providers are grateful because you're essentially enhancing the care that they provide, making them more, um, I guess,
Well,
what's
they
the word?
efficient. They get to,
Efficient.
yeah,
Thank
they get
you.
to be efficient in what they do because
Yeah.
they don't have to worry about all this extra stuff that you can take care of
Yeah, that
for
you're
them.
taking off their plate. So,
Yeah, I found that our best customers are physician practices who are just like really interested in like patient care and quality, who have like internal quality programs. They're trying to like move the needle, and we can come and do it for them at no cost and actually generate some profit on the back
mm,
end for it. So if the ultimate goal is I just want better patient care, you're 100% going to get better patient care. There's like no questioning. You have more access, you have more data. We're going to improve outcomes for those patients, and you're going to get some incremental revenue out of it as well. I think one space we found really interesting is like the federally qualified health centers.
mm,
They are in a unique situation where they have particularly needy patients who have a lot of complex like social needs as well as
hmm
clinical needs. They don't really have a lot of resources to fix them, and FQHCs are particularly understaffed, under resourced to be able to manage some of these. So it's like you have a complex need of patients, a limited availability of staff time to manage them. Those are places where we've done exceedingly well, especially from the patient feedback perspective, because some of them would be, I have to wait, 2 months just to get an appointment to come in and see my primary care physician. But it's like now I have an on-call nurse that can deal with like 95% of the stuff that I need. And then, we're helping them get access to all the services that they need, and also like taking that burden off of the clinic's plate.
yeah. In FYI, for anyone who's listening, FQHC, Federally Qualified Health Center, is basically, well, Jeremy, for us here in Flagstaff, like North Country.
Okay.
Yeah, serving primarily, they usually are kind of like they have all the things, right? Like they've got specialists and primary care and obstetric care, and they've got a pharmacy, and they've got, but largely like Medicaid population utilizes, and then Medicare probably after that, and then Um, but they're a really important part of communities that serve, especially rural areas.
Yeah,
Um,
we're really heavy in rural and deal with a lot of like
yeah.
Medicaid, low income complex patients or
Mhm.
like dual eligible Medicare, Medicaid patients who need
Right.
both.
Yeah. And I was going to say, even, even the most, I don't know, capable of us, we still need somebody to coach us, right? Like I've got all sorts of tools and ways and means and, some privilege, quite honestly. And I would still need somebody to be like, Heather, like get your act together here, like you're making terrible decisions, or like you could be doing this differently. Like it's like having we joke, everyone needs a doula for something.
Yeah.
So like a doula for everything in your life. And to have a chronic condition too, it's overwhelming, I imagine.
I
I don't have one, but
I just need an intern. Can I get an intern?
yeah.
Yeah. I mean, that's one thing I found. And like when we started this and it was like a patient app, like that was great. But at the end of the day, people need someone to be accountable to. And I think having
Mhm.
that person that is like, oh man, I'm going to have my call with Christy on Friday and she's going to see my A1Cs. And like, I'm not doing like that does actually move the needle. And the way we structure things is like you have that relationship with your nurse for a year and a half, so it's not like a triage line where you're like, hey, can you help me quit smoking or whatever? It's like, it's the same person over time. And it's like, I get to know you. I know what your inner workings are and how to move you. And that's really fundamentally one of the things we do, which is why I said like we're partially like a therapist, just like managing this like relationship with the patients and getting them to do the things they want to do and plugging in the biometric stuff. Makes them even more accountable. It's like, sure, I can tell you I was dieting all week, but like when I step on the scale and it transmits that data to the nurse, it's like, huh, why is this happening? Or like, why is your A1C here? Or why is your blood pressure here? Like, you're not doing what you said you're going to do. And I think they know that. And it does create like a different level of accountability for patients that we all need. I mean, I've been in this industry forever and like, I don't understand half of it. I definitely don't understand clinical
Right?
things. And like another thing, I didn't even think about this when we had started, but it's like it's pretty intimidating to go talk to a doctor. It's like I've got all this like stuff going on with me, and I don't want you to like judge me, and like I'm not going to talk to you about this stuff. And plus, it's only like 10 minutes. Like I don't have to tell you everything. People are way more willing to open up and engage with someone like virtually and somebody that is not on a time clock with them that's like running in and out of the office, and will uncover things that are impacting like a patient's health that they wouldn't necessarily want to talk to their doctor about.
Yeah.
And they've told us that, but like I've never told anybody this, but I'm telling you
Mm-hmm.
because like I want to go, fix this or whatever.
Mm-hmm.
Uh, which wasn't like part of the plan, but it's definitely something we have seen in terms of like getting more access to stuff going on with the patients.
I love that. I mean, technology is great, right? Like we all want that, but we also still want that like human interaction. Like that's still so important in healthcare. We don't want robots, right?
Yeah.
Like we don't want just a chat bot that we can talk to. We want like a real human and like that accountability piece, right? Like I remember how many times I've been in like some kind of like group women's wellness group or something to like lose weight or whatever it is. And I was always way more successful when somebody was checking in on me and holding me to meeting goals and doing certain things. And I always had pretty successful outcomes because if it was just me, like, you know, doing something in an app and I got a notification that would said, did you do, well, no, like if like a human person was like, did you do that? And then I'd feel really guilty. So
Yeah. It's easy to lie to an app. It's not as easy
it
to lie
really is.
to a person. Yeah, 100%. And the stuff we do is like, it's so long term to deal with, and it
Hmm.
involves like so much behavioral change and just like mindset shifting of how you're going to deal with this stuff. Like if you think about patients who have diabetes, they've had diabetes for 30 years and they've just been like managing it and dealing with it and like letting it get worse and not really like knowing how to like do anything about it. And then all of a sudden they kind of want to try to improve their condition and don't really know where to start. That's typically like the person we're dealing with. So in like normal context, it would be someone who's like, you know, been overweight for 30 years and now they want to go to the gym. okay, like there's going to be a lot of stumbling blocks. So they're not just going to like show up and go to the gym every single day and like change their diet and lose 100 pounds in, the next 3 months. Like if there's not somebody who's like going to help encourage them that like, yeah, it's okay to fall down and like keep going and stuff. That's one of the things we need to like keep pushing on these patients to deal with, because it's really easy to just like fall off, get lost in the system and not really like continue on your journey to better health.
Yeah, that makes sense. Well, I want just in checking time here, I want to make sure that we start to wrap up here. But in terms of Wellbe Health, like what's next? What are the kind of next big milestones? Is it just continuing to grow? Are you looking into any specific areas of growth or expanding
Um,
services?
Yeah, good question. I mean, I think the main thing we've been dealing with is how to like move from super small startup into like larger stage startup. I mean, we're moving from like a team of like 15 or 20 people into a team of like 100 people, and like managing that change and how do we deal with it like kind of more at scale. And then also just the things on a technology basis, like we're always trying to push the needle on how we use technology. Like I said, we're building our own kind of AI clinical assistant and really trying to understand how do we utilize that best, both for our internal teams and with patients. Like we said, I mean, you can't automate away everything, but there is a lot of things that AI can do that can make work easier for people. So how do we like use that in the right way and figuring that out? And then also like we've just continually like kind of pushed up market for our customer base. We started with like the smallest of small customers, knowing that we'd probably break a bunch of stuff and like didn't want to break anything too big. And now that we've fixed a lot of those things and like we're running efficiently, we know how to do the things we're doing, trying to move up market and kind of finding the sweet spot from a customer perspective. We have everything from we still have some of our very first like single doctor practices all the way up to like enterprise health systems, and figuring out like where do we really fit exactly best. Like one of the things we're doing that's exciting is we've been partnered with Emory Health in Atlanta for a while doing like blood pressure management, and they came back to us to see if we could do a high risk pregnancy program where we're monitoring their like preeclampsia patients during pregnancy for high blood pressure. This is brand new to us, so we had to build like all the whole clinical protocols, like the escalation protocols, bringing on people that can like specialize in OB care. Like that's not our typical like sweet spot. So just expanding, I think, some of the use cases for the service lines that make sense to us that we think we want to get into. And I think just generally moving the company forward into like a better iteration of itself.
Awesome. It's exciting. How many years have you been in existence?
So we technically started like the beginning of 2022.
Okay.
So
I was going to say about 3 years.
yeah, about 3 years.
Yeah. Okay. It's exciting. Big growth. Working for a startup myself right now and having come from one before, it's an exciting time to be a part of that growth. And just kind of seeing what the possibilities are and, solving the big problems, right? Because like, I mean, right, PCPs, they don't have a lot of time, administrative burden. People still need guidance and help, particularly with chronic conditions. So,
And
and chronic conditions make up the majority of healthcare spend. So,
and it
Yeah.
fits all the running themes we've had on the Uprising here
oh yeah.
throughout, really. It's using new technologies to
Mhm.
it helps, make the doctor's offices more efficient. It helps the patients be more in control of their own healthcare journey and just kind of,
Yeah.
makes things work better
Yeah. Yeah.
in general. I mean, that's really kind of the whole process we're seeing with a lot of this stuff
It's nice.
here on the
It's
Uprising.
it's nice. I keep telling everybody because, like you, Seth, I've been in the healthcare industry forever, and it's nice to actually see a real legitimate, like, I want to say almost seismic shift in the healthcare industry. Like we are, we're shaking shit up. That's
Yeah.
what we're doing.
And
I
the
mean, I
proactive nature of it too, like
Yeah.
so many of these things we're getting on the podcast, like what we're talking about today, it's very proactive. It's about
Yeah.
getting to the problem before it becomes more of a problem,
Yeah.
which, I mean, that's the best direction healthcare can move in my mind.
Yeah.
But
Yeah, I think there's a fundamental shift with like patient expectations
Hmm.
as the population ages of
Hmm.
I do everything this way with like every other part of my life, with my travel, with my finances, with my social engagements. Like I want things automated, I want things simple, I want things user friendly. And if you can't give that to me, I'm going to go somewhere else that can do that.
Yeah.
Um, and 10 years ago, that wasn't the case. And I think more and more providers, even if it's like the younger end, like people who are going in to get care now that are 25 are not going to put up with anything unless it's like super efficient.
Right.
That is how they need to think about getting customers, as a physician office. But then also, people our age, people older than us, they're starting to have the same expectations as well because they use, you know, Robinhood as well, and they use like travel apps and Uber. Like
Hmm.
they know that this stuff is possible. Just because they're 65 doesn't mean they don't know anything.
Right.
And like one thing I realized is the traditional like health plans have a very perverse incentive to like not get people well because it's so transient. Like if you spent money to get me well and you're Aetna, and then 2 years from now I switch jobs and I go work for you, my employer gets United or Blue Cross or whatever. It's like, man, I invested in Seth, I got him healthy, and
Hmm.
my competitor is getting the benefit. So like
Right.
if it's not going to move the needle financially in the next like year or 2 years, like I'm not going to spend all that much time on Seth unless he's like a frequent flyer ER person. And
Right.
by that point, there's very little you can really do. So it's like something like Medicare where they're in it forever and like you have to do something like Kaiser where they're probably going to stay there forever, or
Hmm.
you're just like an outside entity with a relationship with a patient that like I want to have a relationship over the next 10 years makes the most sense. Like traditionally it kind of doesn't to do the things we're doing. And I mean I get it. Like that's how the business like operates.
Yeah. No, that makes so much sense too. I didn't really think about it from like until you said it, it was like, oh, duh, like employers, right? Employer provided healthcare, like a United or an Aetna or whatever. And if you're going to be gone and somewhere else, and people don't stay in jobs very long anymore. They're not in these, with pensions and stuff like, you know, for 25, 30 years. That's pretty rare. And so people are
Yeah.
not job hopping, but they're not staying anywhere long, whether by choice or just because that is just how the universe works today. So why would you invest into
Yeah. And
that?
even
So
if they
coming in,
did, like my employer could switch next year anyway. It's not like I have a relationship with
right?
Aetna and I'm going to keep them for 50 years. Like, hey, if Blue
Exactly.
Cross comes in and offers me a 5% discount, I'm just going to move. It's all
Yeah.
simple services. So it's kind of
Yeah.
hard to invest in that population in something
Mhm.
that's going to get returns in 5 or 10 years. But, health doesn't provide returns quarter over quarter. It's like this is going to be 10
Mhm.
years down the road when you're going to really feel the impacts of it.
Yeah. So that relationship with the provider is even all that more important, right? Like that's the one you want to keep intact. And
Yeah.
so having that kind of support, like from a Welby Health, makes so much sense.
Yeah,
Yeah.
the odds I will keep my doctor for 10 years are a
Hmm.
lot higher than the odds that I will be in the same job and that same
Yeah.
job, have the same health plan. I'm much more likely to still have my doctor and he's going to
Hmm.
know what's happened with me over the last like 10 years.
Right. True. Wow. Well, another exciting, interesting conversation. Before we let you go here today, Seth, let us know where can we find you online, social media. How would somebody get a hold of you to get started if they're interested?
Yeah, we don't have a huge social media presence. I mean, we're Welby Health. Our website's welbyhealth.org. Most of our social media stuff is under Get Welby, so like LinkedIn, Facebook, X, that type of stuff. And just you can also email us just info@getwellbe.com or info@wellbehealth.org. And you can reach out anytime.
Awesome. Well, great. Seth, thank you so much for coming on. This has been interesting, and it's just good to know that there's somebody else out there doing something to help really solve the complications and the complexity of the healthcare industry and really kind of plugging in where we need it most. So,
Yeah.
yeah, so I'm excited that you joined us. So, and I'm super excited for all of your growth and everything. It's just a big deal to build a company and to see it change and grow and go from 50 to 100 employees. Like that's massive. So really congrats on the success so far and all of it to come. So
Yeah, appreciate it. We do our little part. It was really fun to talk to you. I love chatting about healthcare stuff when it's not a very specific outcome required. It's such a nuanced market too. There's like not all that many people who understand anything about what we do. So talking to other people who do it is always fun.
yeah.
I'm learning as I go. And yeah, it's not the easiest thing, let me tell you.
It's a lot. Like sometimes I'll talk to like my salespeople or something, and they'll just like listen to me on phone calls with them. And he's like, "How do you know about like, well, like whatever?" And I'm like, "I don't know. I thought everybody knew about that." It's like I never even heard of that before. I don't know what that is. I'm like, yeah, I guess that's just like institutional knowledge of like hanging around the hoop for 20 years.
Yep.
Yeah.
Well, and hopefully what we try to do anyway with these conversations is that we make it kind of informal and unstuffy enough that somebody will be listening, and we've got a pretty mixed bag of an audience too, that they'll start to understand like the value of a Welby Health, whether they're a patient or a provider or
Yeah,
just some random person, that
yeah, for sure.
we're all patients,
We are
Yeah.
all
right?
patients.
Every single one of us are at some point in our life. So,
Yeah.
yeah.
And there you go. Our conversation with Seth from Welby. Really cool stuff. Before we get into the nitty gritty of it, though, I one of those anagrams got by me. He said soap, which
Soap.
SOAP. Do you know what that means?
I don't even know what that means.
We're gonna have to look that one up.
That's a new one. The healthcare industry acronym dictionary is relatively long.
Yeah, yeah, it's kind of endless, and I try to ask in the moment what things mean. I missed that one in real time. I will put it in the show notes. So let's get into the main takeaways here. Heather, what do you got for us?
So, as I mentioned in the intro to the show, and Seth and I talked about this during our discussion with him because Seth and I work together, and in the value-based care, kind of space within the healthcare industry, which really kind of came on the market back in around 2010 when it started getting some traction. So it's been around for a while. But the biggest issue is that like large health plans are just they're big, right? And it's like moving the Titanic, right? You're going to hit an iceberg. Um, and as much as they want to be, a part of that value-based care stuff, the accountable care organizations and joint ventures, like we talked about, they just can't be very nimble because of some of the bureaucracy and it's these big
Yeah.
administrations. Whereas like Wellbe Health, as a small tech startup in the healthcare space, can be nimble and can actually solve for the same problems that the Aetnas and the Uniteds and the Anthems of the world are trying to solve for. They can just do it better, quite honestly.
Right.
They can just do it. And that's what Wellbe Health is doing, going at it from a provider first perspective, like independent, provider groups that have, patient panels with, you know, chronic conditions. And those are the folks that need, the most help because they're like the smallest percentage of the patient panel, but the largest percentage of cost. And that's really where they need to plug into. And that's what Wellbe Health is doing. So they're really solving for that very head on. And I think it's just really exciting to see them doing that.
Yeah,
So,
yeah, yeah. It's another great niche to fill that we're covering here on the Uprising. But to me, conversations like this, I mean, he's talking about how all the different employers, because healthcare is mainly employer based and they all have different programs depending on who you work for. And then there's different administrative processes that you got to go through these different programs depending on who your provider is. And just so overtly and needlessly complex.
yeah,
I feel like if we would just centralize healthcare and have a single payer program, then these problems wouldn't exist to begin with, and we wouldn't need companies like this to solve these problems because they wouldn't exist.
right. Yeah. Yeah.
But considering that America can't get its act together to to be an actual first world country. I guess it's a wonderful thing that we have companies like this coming around.
Yeah. And technology it's a huge part. It's like we talk about this all the time, you're empowered by technology and access to data and having it on your phone, and remote monitoring like that Welby Health does.
Yeah.
um, Avoiding going to the ER or urgent care, basically getting out in front of problems before they get worse. Like
Yeah.
that is such a theme in what we talk about. And people are they're getting out in front of things because they're given the tools and the technology to do that. And then there's companies like Welby that are showing up and saying, "Hey, we want to help you and we want to make sure that you stay well."
Yeah, it's cool. It seems like really basically 100% of all new innovation is based on preventative care,
Yes, yeah, I think you're right.
which is where we need to go. Like, don't get sick to begin with. It's
Hmm.
so much better that way.
Right. It's a lot cheaper to
Yeah.
not get
And
sick,
just better
and
for
it's
everybody.
and it's better for just the human race in general.
It's better for the money. It's better for the patient. It's better for the doctor. It's better for the insurance company. It's better for the employer. It's better for everybody in every way if we just don't get sick to begin with.
True. So
So let's do that.
let's do that. I'm on board.
All right. So if you're down with that plan, make sure you hit the likes and subscribes, share, auto download so you don't miss a beat with the healthcare here. We are on all the major listening platforms. We are on YouTube if you want to see us on video and put a face to the voice kind of thing. Uh, I don't forget what else I'm supposed to say. What else would we say, Heather?
You can also find us online at healthcareuprising.com. And of course, we are on all the social media sites like Blue Sky and Instagram and LinkedIn and Facebook. So definitely take a peek for us out there. Follow, like all the things on the socials to keep up with when our podcasts drop. And we share a lot of stories from our past guests, their posts, so you can keep up on all things healthcare.
There you go.
What else? Always looking for folks to come on the show, whether you're a CEO, founder, doing something innovative in the healthcare space. And it doesn't have to be a technology, it doesn't have to be an app. Innovation shows up in a lot of different ways. We'd love to have you on. Also, for human stories, do you have a healthcare experience that you'd like to share that you think people could benefit from hearing? We'd like to hear from you too. So give us an email, shout at healthcareuprising@gmail.com, and we would love to have you on.
I saw something on our schedule when I was looking at it earlier today. We're going to interview somebody about breathing therapy.
We are.
So yeah, it doesn't have to be techie at all.
No, it sure doesn't. So I think that's it. This is your dose of healthcare for the day. And with that, keep looking for the good in the world. Sometimes it is where you least expect it.
This has been a Shut Up production.
Shut up!